this has been a little bit of a dream to create a class that is going to be taught by the team that I work with every day and share the additional knowledge that we need as we move from utilizing these 16 steps and working with our mounted casts and doing all the things that we taught you in the core curriculum to now looking at this in a more advanced way where we can start getting really clear on what the specialists can do for us. The other thing that I think is really important to this end is to understand that it is just as important for the other members of the team to be there with you. I look at this class as a 2.5, sort of a 3-day retreat where you can bring key people with you, a key orthodontist, key specialists in your area to start to really develop a protocol on how you're going to handle these cases. And so with that, I thought it might be interesting to hear from the group and maybe from their perspective what they've also gleaned from this. So putting you on the spot, Albert, I've worked with you the longest, so what do you see?
Yeah, as a periodontist, it's really a wonderful opportunity to work with really talented individuals. I've learned a tremendous amount about dentistry that I never really knew before. John's taught me about cosmetics, and Mike has taught me a lot about orthodontic surgery and what we can gain from it. And certainly Carl has given me some of the diagnostic acumen and orthodontics that I've needed. So it makes me a better practitioner, particularly working with these guys, but working with other people as well. So I would certainly highly recommend, bringing your periodontist to this program because it'll just make him a better periodontist. It'll make it easier to work with. I think we have a lot of techniques that can enhance what we're doing from an interdisciplinary standpoint. So no longer do we have to accept the way the environment exists at the present time. We can look to the ideal and then set about creating an ideal environment for the patient, and working with John and Mike and Carl in an interdisciplinary fashion creates a mechanism to accomplish this.
Yeah, I think that one of the things too that is important maybe to recognize is, sometimes we'll go through a treatment planning process and we'll have a real visual picture. And let's take an example of a case that might need crown lengthening for aesthetic purposes, or maybe some soft tissue grafting. And we'll have a visual picture of what we want to accomplish, but what I found is that unless there's some common philosophies about what everybody's seeing, when you refer something out for a specific procedure, it may not come back the way you visualized it unless there's some clear communication on what the goal is and how we're going to communicate that. And so, the whole idea of just writing a letter, just doesn't always cut it.
Sure, and so working with people closely, you develop those techniques and those communication skills so that what you're envisioning is in fact what you get back. And I think that's key.
Yeah.
I think you also develop a much better treatment plan, more complete treatment plan, because no stone is left unturned.
Mm-hmm.
Basically, you're considering every facet of treatment. As a surgeon, I don't really, certain considerations that I miss that meeting as a group, we're not going to miss.
Yeah, that's a good point.
It's very important that all factors are considered when you're making your treatment plan.
Yeah. Over the years, you've learned what you've learned, but you tend to see everything through your paradigm. And I think what's most exciting about having a group like this is by meeting each month, you open your box.
Yeah. Well, I think what's interesting is that, and this is maybe the greatest irony that I've learned, is often with my patients, unless I know all the arrows in the quiver that you guys have, it never gets treatment planned.
Sure.
And so by us being able to put a picture up and say, what do you see, what do you see, what do you see? Well, the truth is, we see it 4 different ways. And if we really look at what interdisciplinary treatment planning is about, and this is maybe one of the things you have to come to grips with as a restorative dentistry, or as a restorative dentist, is it often leads to less dentistry in the end. The person at the end often has less restorative dentistry in their mouth, but a far better outcome,
quality.
far better treatment outcome for the patient, which creates happier patients, which creates more referrals, and it spins on itself. So maybe Carl, I mean, you've chimed in here, but what is it that you're sort of have liked most about this environment?
Well, you mentioned it, just the idea of all of us learning what each other can accomplish. And, we all bring our expertise to the table. But there are certain things that I look at and say, well, I can move the tooth this far. But there are things Albert and Mike can do as far as, changing the gingival topography or moving the teeth, and things that you can accomplish that, where we might be getting into some heroics, trying to move the tooth, leave the tooth center and done, and
Let us do what we do.
I think it's also important to know what each of us can't do.
Exactly.
Which is really important, because sometimes if you haven't, I'm sure you've seen unfavorable orthognathic cases where they say, well, you can finish that orthodontically, and you just kind of look, and that's not going to happen. So I think it's important to know what we can't do as well,
Sure, right.
and then come up with something that will work for the patient.
So you can have realistic expectations
Yeah,
for
absolutely.
the patient.
unfortunately, historically, you have a situation like that where the surgery comes back, not really in the ballpark, and then you're having to shoot by the seat of your pants, and nothing ends up being as good as it should be.
And that's the advantage of being in a group like this, is that you know when something's not right.
Right.
From an orthodontic standpoint, periodontal standpoint, you know that if, you've done interdental cuts and you have a soft tissue defect, well, Albert needs to see that patient. If you have an open bite that can't be closed orthodontically, you need to either redo the surgery or
Right.
You
need to
just
fix
don't restore the teeth longer.
you.
So the last person here, Mike here, we've been working together now a couple years. I'll just say from my perspective, one of the things that I've learned a ton, and maybe you can comment about it, I really thought that all the surgeon did was sort of take teeth out and do orthodontic surgery. But DDO, there's all these things in the orthodontic implants and stuff. It's a whole new paradigm for ways to make pretty significant skeletal changes without necessarily always having to break the face and segments.
Well, there's more than one way to get from point A to point B. It's just you have to understand if it's going to work. Like, you have to know the limitations of your treatment plan. And, I think we have a lot of tools in our bag where the patient can end up with a great result.
Mm-hmm.
The problem is, I have to know what's in your bags as well, so that we can come up with something that will be predictable and end up with a good result.
One of the things that I've learned maybe the most is really how difficult a job orthodontics is, from the standpoint of you trying to make teeth fit inside of this buccal and lingual plate, and how often the things that you're facing are skeletal.
Right.
And so what I've been sort of amazed at is how often you all talk. I mean, you might tell they're actually twins.
Carl and I were classmates.
They were
And
classmates.
we've known Carl
Our brothers in dental school.
Yeah.
35 years?
Yeah,
But seriously, I mean, you guys talk constantly about
several
cases.
times a week.
Yeah.
Easily.
Yeah. So with that, we don't want to take this, go this too long, but I just want to say that from my perspective, as you're finishing this core curriculum and as you're starting to do more complicated, complex restorative dentistry, one of the things you're going to find out very quickly is that as you go through our 4 options of treatment, reshaping, repositioning, restoring, and repositioning bone, more times than not, there's going to be transverse issues, there's going to be tooth position problems, gingival problems. There's going to be things that you can't fix all by yourself. And so I just implore you to look out into your community, find the people that share your same philosophical approach to dentistry and to quality, and take this opportunity to come spend the weekend with us. I think you'll enjoy it, and I think it could be a nice launch pad for the second part of our curriculum. So with that, good night. Appreciate it.